Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during our regular show. All of your questions are important to us and we want to answer as many as we can for you. And thank you, Brian, for staying afterwards, and thank you, Lon Kightlinger, for joining us afterwards as well. First question is, what treatment is used to treat syphilis for those who are allergic to penicillin?
There are alternative treatments for penicillin allergic patients. So you can use ceftriaxone or doxycycline, depending on the stage of the illness. However, I do want to make a comment that for pregnant people, if you do have syphilis, penicillin is the only treatment. So you will need to undergo penicillin desensitization in order to get penicillin safely.
Okay. And let's run it quickly. So condyloma, what's the treatment for that? The genital warts.
Genital warts. So a lot of things, you can use cryotherapy to remove them. Okay. That is probably the treatment that's most commonly done.
And gonorrhea, the typical treatment is?
Gonorrhea is ceftriaxone with azithromycin.
Okay, and for chlamydia?
Chlamydia is azithromycin or doxycycline.
Okay. And for herpes simplex?
It's mostly in the acyclovir family, valacyclovir, famciclovir, or penciclovir.
And HIV?
HIV.
It's a complex story.
Yes. Mm-hmm.
And then we have not talked about hepatitis C, but it is not so sexually transmittable, but it is sexually transmitted.
Correct.
Here's a question. What are the risks associated with contracting STIs from kissing or oral sex?
So most of the sexually transmitted infections are obtained through direct contact. So anytime you have skin problems, ulcers, for instance, like if you have HSV, you can readily contract it by simple touch.
HSV, herpes simplex.
Correct.
So,
herpes simplex, yes. And that's pretty much the same, even for warts.
Now, the herpes simplex that occurs on the mouth, is that exactly the same as occurs in the genitalia?
So there are two types of herpes simplex, 1 and 2. Traditionally, type 1 is above the waist, type 2 is below the waist, but there are now, that line is not a pure seen line anymore. Yes.
No, and so if you have herpes simplex on the mouth, you can give it to a person in the genital if
Correct.
You're doing oral sex. Lon Kightlinger, any comments that we've said so far? This is more on the therapy line.
No, you cover the treatment end of it. Yeah, that's fine.
All right. Had blisters everywhere and turned into purple lumps, used steroids to get rid of them, had promiscuous husband. Could her blisters have been caused by an STI?
It's very possible. The things that run in my mind are syphilis, herpes. It all depends actually on the skin lesion, so you probably will need to be seen by a doctor to be evaluated.
But there are many things that can cause blisters.
Yes.
People can have a immunological disease, pemphigus, pemphigoid, allergic reactions. You could have contact dermatitis associated with poison ivy. So there's a lot of things that can cause blisters, and if it was everywhere, that would suggest more likely not herpes simplex from sexual activity. Here's from Spearfish. Caller has had a foul odor for months. Could this indicate an STI? So a vaginal foul odor.
Yes, it could be reflective of trichomoniasis. Bacterial vaginosis actually can present this way, and even gonorrhea, chlamydia can present as a foul-smelling odor.
So, but there are other, it may not be a sexually transmitted disease as well.
To begin with, yes.
Many people can have a foul odor down there, and it's not sexually transmitted illness. So you can't conclude one equals that. But certainly the trichomoniasis, you said trichomoniasis.
Yes.
That's the proper way the infectious disease person says it correctly. Lon, anything so far that you'd like to say? Trichomoniasis, any comment about that?
Well, I'd say trichomoniasis, and that's one of the diseases we do not track in the health department. So I have no data on that. I don't know how common it is exactly in South Dakota, but I know it's definitely out there and needs to be treated.
And how do you treat that?
Metronidazole or tinidazole.
Okay, so, and the question is metronidazole or metronidazole, is trichomoniasis now resistant or getting resistant to metronidazole or Flagyl?
Yes. So there have been cases of resistance, and you have to follow an actual sequence of steps in order to successfully treat seemingly resistant trichomonas infections.
So there's another, if that fails, there's another drug, and if that fails, there's another drug, but we're running out of drugs, aren't we?
Correct, yes. So they're in the same family, though.
And then from Yankton, this is a non-sexually transmitted infection question, but someone was curious about radioactive thyroid treatment. They need to be isolated and wondering about this treatment. Now you're an internist. You
Yes.
can answer isolation about radioactive iodine.
Yeah, we can answer that both.
Okay, go ahead.
So yes, during the when you are undergoing current treatment for it, patients are in isolation. And then after they release you from the hospital, you should not be a risk to public safety anymore.
Right. So I mean, you have an isolated period of time that
Yes.
and then after that you're okay.
Yes.
And the treatment for thyroid cancer is extremely good. So you can be positive about getting good treatment. This is the end of our questions. I'm going to ask you both to take a bottom line here. Lon, would you like to make a comment or a final words of advice to the people who are watching?
I'd only like to say that it's very disturbing and distressing to us that we should have this increase in sexually transmitted infections these days. We want to see it going in the opposite direction. And I realize these are diseases that are difficult to confront. They're complex. The solutions are not all medical. They're not all public health. There's a social component to it. There's a behavioral component to it. So it takes a lot of people working on it, but it comes down to the individual in the end.
All right, and thank you, Dr. Lon Kightlinger, State Epidemiologist. Now, Dr. Brian Pepito at Avera Infectious Disease, or it's Infectious Disease Group.
Yes.
What is it called?
Infectious Disease Specialists.
All right, so you're loosely attached to Avera. Mm-hmm. So what bottom line comments would you like to make sure that people are left learning?
It is very unfortunate that sexually transmitted infections are on the rise. Fortunately, sexually transmitted infections are easily treated. Most infections are symptomatic, but there are very few cases where you don't have any symptoms at all. It is very important that you see your doctor if you're concerned about a possible infection, and in order to help contracting the illness, you should be very smart about your decisions.
Okay, and my take home is good people all around will sometimes have infections. There's no moral judgment there. You go to your doctor in the privacy of her or his office. You talk with them and get some help. We do not want to cover this one up. This one is absolutely important to seek some help. Or your nurse practitioner or your PA. So let's get some help somewhere. And with that, I want to thank you both for joining us. Thank you all for joining on our website. We appreciate all your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Broadcasting at our regular time. And until next time, stay healthy out there, people.